Therapists are trained to handle a plethora of situations, ranging from mental illness to physical ailments. As with any problem presented, therapists need to be able to properly assess and understand the individual's problem. Suicide has been a big issue for health professionals. It is important therapists be able to recognize and help those in need of support. An act or an instance of taking one's own life voluntarily and intentionally, especially by a person of years of discretion and of sound mind. Suicide is a tragedy that affects thousands. It is a trend that is not improving. The rates of suicide have increased exponentially in the last decade, as you can see by this chart. Therapists, among health professionals, are not in tune with some of the misconceptions that go along with suicide. What many are not aware of is the suicidal state is treatable and can be treated. Therapists who are not properly equipped to handle suicidal cases tend to pass their patients around to other therapists, like a hot potato. The problem is clear. Therapists need to be more. Suicide is an issue that should not be taken lightly by anyone. A friend, neighbor, or even a family member who is feeling depressed is at risk for suicide. It is important therapists be able to handle such cases. Dr. Lisa Firestone, a clinical psychologist at the Glendon Association, says, quote, "By understanding what's going on inside the suicidal person's mind, recognizing warning signs, having a decision tree for assessing and managing suicide risk, and knowing which treatments are most effective, therapists can save lives." Unquote. If you were worried about someone close to you becoming suicidal, wouldn't you want a therapist who can help and save a life?